So you have these symptoms. The question is, how can you find out what's going on with you? Well, there are a couple of ways. The first way, you go to your doctor. You get some fasting blood tests, and they have to be fasting. If they're not fasting, don't bother. What do you want to know? The very first blood test that will tell you about mitochondrial function is a fasting insulin, because a fasting insulin basically tells you whether or not the cells are importing glucose by themselves or whether they need help from insulin to do so. So it is one step removed from mitochondrial dysfunction. Now, I will be very honest with you. The American Diabetes Association tells you don't draw a fasting insulin. And right now, insurance companies don't approve fasting insulin for reimbursement. So this is a major problem. Why is it that I say it is the single most important test and the American Diabetes Association says don't draw it at all? This is a fight that we are having, and I'm going to win. And here's why. The reason that the American Diabetes Association says don't draw fasting insulin is twofold, and both of them are specious and wrong. First, the American Diabetes Association says don't draw a fasting insulin because insulin assays are not standardized across various platforms across the country. Now, that is true. Different assays do fasting insulin levels in different ways. That is true. I don't argue that. But if you are a patient and your doctor is sending your fasting insulin to the same assay each time, then that does not become a problem. Right? One of the reasons why fasting insulin is not standardized across assays is because certain fasting insulin tests can pick up other interfering substances. One of the most common ones is called pro-insulin. So pro-insulin is a precursor to insulin. When your beta cell releases insulin, it has to cleave a piece out of the pro-insulin molecule. That piece is called C-peptide. And then the mature insulin molecule is released. When your pancreas is under duress, when it has to put out everything it needs to in order to get the blood glucose down, it will sometimes put out pro-insulin before that little C-peptide piece has a chance to be cleaved. So not only do you have hyperinsulinemia, you have hyperproinsulinemia, and the insulin assay will pick up both. So you will get a factitiously high level. That is true. So what? It doesn't matter. If it's high, you've got a problem and you need to know it. So that's the first problem. The second problem is the American Diabetes Association says, well, fasting insulin does not correlate with obesity. That's right. And that's because there are way more people who are metabolically ill than there are obese. Fasting insulin correlates with metabolic health, and that's what you want to know. That's why you are watching this video. So, as far as I'm concerned, fasting insulin is the single most important lab test that you can get, and you need to basically sit on your doctor until you get it. Next, what else can you find out? Well, there are some lab tests that are drawn routinely every year. One of them is called an ALT, alanine aminotransferase. It is a standard liver function test. It is a test that you have had done and you have access to. Your doctor probably told you, your ALT is fine, don't worry about it. The problem here is the reference range. When the doctor tells you that, he's reading off a sheet, and there's a column next to the result, and it says high or low, or normal. That column is the problem. And the reason is because the entire curve of the entire American population has shifted to the right. When I entered medical school in 1976, The upper limit for ALT was 25. Today, on that lab sheet, the upper limit for ALT is 40. So if you have an ALT of 35, your doctor will tell you it's normal. I will tell you it's not. And the reason is because everyone now has fatty liver disease. 45% of Americans have fatty liver disease and they don't know it. And so when they go and get their blood drawn at a standard lab, how do you figure out what's a normal range? Well, you take 10,000 or 100,000 lab specimens and you draw the Gaussian curve and you draw 2 standard deviations from the mean and you say, okay, anything above that is abnormal. And that's 40 today. But in fact, if you did that in 1976, that would be 25. The point is, any ALT above 25 is fatty liver until proven otherwise. And if you're African American, any ALT above 20 is fatty liver until proven otherwise. So you have to know your reference range. A third test that you can get easily is called uric acid. And uric acid is extremely important because it's the factor that's leading to high blood pressure and also gout. It's what's going on in the endothelial cells in the vasculature to lead to high blood pressure. Now, a normal uric acid is below 5.5, but on the lab slip, it will say that a normal uric acid is below 7. 5.5 or 7. It's the same issue. The entire curve has shifted to the right. So you need to know how to be able to read these blood tests in order to be able to glean the information that you need out of it. And the question is, does your doctor know how? They may not. In fact, I'll put money down they don't, because they've never learned what metabolic health is. Now, there are other tests as well. For instance, triglyceride level. Now, a lot of people don't look at the triglyceride level because in order to understand the triglyceride level, you have to be fasting. And this is why I said you have to get your fasting labs. A lot of doctors, they don't tell you to come in fasting. You show up at 11 o'clock, you've already eaten breakfast. Don't bother getting a triglyceride. It will be abnormal because you've eaten. It only works if you've been fasting for 6 to 8 hours. So you need to come in fasting for that blood lipid panel. LDL turns out to be not nearly as important as doctors say. Triglyceride is way more important. Triglyceride has a hazard risk ratio for heart disease of 1.8, whereas LDL only has a hazard risk ratio for heart disease of 1.3. Triglyceride is 50% more valuable in predicting heart disease than LDL ever was. The doctors out on the street probably don't know this, but your doctors at LifeMD do, because I taught them.